Nursing history. History of past illness. A 60-year-old man with known coronary artery disease complained to coworkers of intermittent chest pain for several days prior to admission. On the morning of admission, he developed crushing chest pain at work and then lost consciousness. History of present illness. At the time of presentation to the emergency department, he was hypoxemic and hypotensive. He was intubated prior to emergent coronary angiography. Coronary angiogram revealed a complete occlusion at the site of a prior proximal left anterior descending LAD coronary artery stent, FIG, 11.2, as well as a 70% stenosis of the mid-right coronary artery. After much difficulty, a wire was passed through the proximal LAD blockage, and the artery was restented with restoration of normal flow. The patient remained hypotensive, requiring vasopressor support with norepinephrine to maintain a blood pressure of 80/60 mmHg.
Laboratory and diagnostics. Electrocardiogram. An electrocardiogram is one of the simplest and fastest tests used to evaluate the heart. Electrodes are placed at certain spots on the chest, arms, and legs. The electrodes are connected to an ECG machine by lead wires. The electrical activity of the heart is then measured, interpreted, and printed out. No electricity is sent into the body. Purpose of electrocardiography: 8. To help identify primary conduction abnormalities, cardiac arrhythmias, cardiac hypertrophy, pericarditis, electrolyte imbalances, myocardial ischemia, and the site and extent of myocardial infarction. To monitor recovery from an MI. To evaluate the effectiveness of cardiac medication. To assess pacemaker performance. To determine effectiveness of thrombolytic therapy and the resolution of ST segment depression or elevation and T-wave changes. Results. Reported an initial cardiac rhythm of ventricular fibrillation. He was successfully resuscitated and a post-arrest.
A coronary angiogram is a procedure that uses X-ray imaging to see your heart's blood vessels. The test is generally done to see if there's a restriction in blood flow going to the heart. Coronary angiograms are part of a general group of procedures known as heart, cardiac, catheterizations. Cardiac catheterization procedures can both diagnose and treat heart and blood vessel conditions.
Created using Powtoon.